So today I've received a call on the radio. We are going out to a 27-year-old female. She's at her residence, which is 27 John Street, Oran Park. She's got abdominal pains. We've been told that she's got nil flu or COVID symptoms. There's no animals on the premises, and the best route for the drive to the place is put into the system. So on the arrival, I ensure I've got my PPE in. 1 second, bub. I've got my mask, I've got face wear, I've got my gloves. I also assess the dangers on the property, which I can confirm there's no dog as I arrive. There's no steps into the front. And I know my access and my egress all straight through the front door. So the patient has actually come to the door and entered the door when we arrived. She was hunched over, she was clutching at her stomach, she was in pain. There was no signs of an external hemorrhage. The patient, she appeared to have clear airways, she was breathing, she was maintaining her own. She had equal air entry, and she was able to speak a full sentence to myself. She was slightly pale, but her cap refills were less than 3 seconds, and she was Pearl on assessment. Used my pen for that, my pen light. So it is urgent to get this patient to the hospital, but we won't have to have lights and sirens, and I don't believe we'll need to have the backup. We will be able to do this with me and my crewmate. We have taken blood pressure for the patient. Her blood pressure was 110/70, and the heart rate was at 75. Her respiratory rate was at 20. Her SPO levels were at 100% with the room air, and she had a GCS score of 15. We did do a quick ECG, results come back, she was fine, no arrhythmic, she was no tachycardic. So we've asked the patient what's happened. She's awoken with the abdominal pains. She said they start at around 2:30 a.m. She said she has an she's got an allergy to penicillin. We've asked her, are you taking any medication? She said no, she's just taken 2 Panadol tablets at 3:30 to try to ease the pain her own. She said it's not a problem she's had in the past, but there's a slight possibility she could be pregnant, and how far along she was, she said it's possible she could be 7 weeks. The last time she had a drink a cordial, and that was around 10:30 the night before she went to bed. She said there was no symptoms on set. She was sleeping and awoke with this pain in the stomach. She said it was around the 2:30 mark. Nothing eases the pain. There's no way that she can move and maneuver herself to have that pain ease. It's just a constant pain. We asked if it's a sharp pain, dull pain, and she said it's a sharp stabbing pain. And we asked about the area of the radiation. She said the pain's always in the lower right side. It doesn't radiate anywhere. We've asked her the pain score, 0 being not bad, 10 being the worst pain she could imaginable. She said that the pain was a 7. The pain's been on for about an hour, she stated, and it's a constant pain. We've asked her if she's done any exercise in the past day or two just to see if it's contributing, and she said there's been no exercise done. So we've loaded her into the ambulance and we've taken her off to the hospital. So just a quick one, when we've gotten back to the hospital, we've let her know, name's Jordan, she's a 27-year-old female. She appeared pale on arrival. She had slight distress with pain. She walked to the ambulance. She was hunched while walking. She was clutching at the lower right side. Just having severe sharp pains in the abdominal area. There was no prior injury leading up to the pain, and it was a sudden onset pain. The patient woke from sleep at approximately 2:30 hours with sudden onset sharp pain to the lower right quadrant. She's rated at a 7 on the pain scale, at rest and on movement. The patient has taken 1,000 paracetamol to ease the pain at 3:30 hours. It's had no effect. She's got a known allergy to penicillin. There's no current medications taken other than the paracetamol. The history of abdominal pain is nil. And leading into this, the patient has also stated there's a possibility of being 7 weeks pregnant.